Hello everyone, myself Vaishnavi Mote and my topic is anti-emetics, prokinetic and digestant drugs. At the end of the session, you will learn about 5-HT3 antagonist, NK1 receptor antagonist, adjuvant anti-emetics, digestant and gallstone dissolving drugs. Introduction. Emesis. Emetic occurs due to stimulation of emetic center situated in medulla oblongata. Various unpleasant sensory stimuli such as bad odor, ghastly sight, severe pain as well as fear cause nausea and vomiting through higher centers. Nausea is accompanied by reduced gastric tone and peristalsis. Overview of antiemetics. Antiemetics are medications used to prevent or treat nausea and vomiting. This slide provides an overview of different classes of antiemetics, including serotonin antagonist, dopamine antagonist, and neurokinin receptor antagonist. First, we will discuss about 5-HT3 antagonist, which includes ondansetron, granisetron, palanosetron, ramesetron. Above drugs are drug of choice for chemotherapy induced vomiting and radiotherapy induced vomiting and postoperative vomiting. First, ondansetron. It blocks depolarizing action of 5-HT3 exerted through 5-HT3 receptor on vagal afferents in the GIT as well as NTS and CTZ. It blocks emetogenic impulses mainly at their peripheral origin in the GIT and at their central relay. Oral bioavailability of ondansetron is 60 to 70%. Duration of action is 8 to 12 hours. Side effects: headache, dizziness, mild constipation, and abdominal discomfort occur in few patients. Hypotension, bradycardia, chest pain, allergic reactions are reported, especially after IV injection. Palanosetron, longest acting 5-HT3 blocker having highest affinity for 5-HT receptors. Side effects: headache, fatigue, dizziness, abdominal pain. QT prolongation can occur when given with moxifloxacin, erythromycin, antipsychotics and antidepressant. Third, granisetron, 10 times more potent than ondansetron and probably more effective during repeat cycle of chemotherapy. Needs to be given only twice on the day of chemotherapy. Side effects similar as ondansetron. Then secondly, we will discuss about NK1 receptor antagonist, which includes aprepitant, nupitant, rolapitant. Above drugs are drug of choice for delayed vomiting by cisplatin. Aprepitant, recently introduced a selective high affinity NK1 receptor antagonist that blocks emetic action of substance P with little effect on 5-HT3 and D2 or other receptor. Oral aprepitant combined with standard IV ondansetron and dexamethasone regimen significantly enhanced the antiemetic efficacy to protect patient against high emetogenic cisplatin based chemotherapy. Side effects: weakness, fatigue and rarely rise the liver enzymes. Third, we will discuss about adjuvant antiemetics, which include corticosteroids, benzodiazepines, and cannabinoids. First, corticosteroids. It can partly alleviate nausea and vomiting due to moderately emetogenic chemotherapy. It enhances efficacy against both acute and delayed emesis. Dexamethasone 8 mg per day oral from 2 to 5th day of chemotherapy helps to alleviate delayed vomiting. Second, benzodiazepines. Diazepam, lorazepam given before chemotherapy as adjunct to metoclopramide or ondansetron help by relieving the psychogenic component and anticipatory vomiting. Third, cannabinoids possesses antiemetic activity against moderately emetogenic chemotherapy. Then we will discuss about digestant. Digestant are the substances intended to promote digestion of the food. Types of the digestant. There are various types of digestant including enzymes, antacids and proton pump inhibitors. First, pepsin used along with HCl in gastric alkalia due to atrophic gastritis and gastric carcinoma. Second, pupin, proteolytic enzyme obtained from raw papaya. Third, pancreatic, mix of pancreatic enzymes obtained from hog and pig pancreas. It contains amylase, trypsin and lipase indicated in chronic pancreatitis. Then fat and nitrogen content of stools may be reduced and diarrhea may be prevented. Then we will discuss about gallstone dissolving drugs. Gallstones can cause significant discomfort and complications. This slide introduces the concept of gallstone dissolving drugs and their potential in non-surgical management of gallstone. Chinodioxylic acid and ursodeoxylic acid decrease cholesterol content of bile, enabling solubilization of cholesterol from stone surface. Chinodioxycholic acid means ginodiol. which is not used now because it is less effective and frequently causes diarrhea. Can raise plasma, LDH, cholesterol and carries risk of liver damage. Second, ursodeoxycholic acid means ursodiol, which is hydroxyepimer of chinodiol, which is more effective and needs to be given at lower doses. Then we will discuss about MCQs based on topics we have learned today. First, ondansetron acts by inhibiting which of the following receptors? A. 5-HT1, B. 5-HT2, 3. 5-HT3 and 4. 5-HT4. We have learned today that ondansetron acts on 5-HT3 receptors. Second, radiotherapy or chemotherapy induced vomiting is controlled by, that is first, domperidone, second, metoclopramide, third, pelanosetron, D. hyoscine. That we know that answer is pelanosetron. Third, cisplatin induced vomiting is controlled by A. prochlorperazine, ondansetron, C. promethazine, D. mozapride. Answer is ondansetron. Which of the following is adjuvant antiemetics? We know that there are three adjuvant antiemetics: corticosteroids, benzodiazepines and cannabinoids. So the answer is all of the above. Last, which of the following is gallstone dissolving drug? We know that there are two types of gallstone dissolving drugs, chinodiol and ursodiol. So the answer is D, 1 and 2. Thank you everyone.